Gonna do an interview today with the owner of Kids Dental Center. We're with Dr. Reynolds, and these questions are gonna help us get to know you a little better, and it'll also allow the community to know more about you. Our first question is, what made you want to become a dentist?
Ever since a young age, I really liked working with my hands, and I built Legos, I built K'NEX, I love drawing and art. I wanted to be an architect at one time. In high school, you really don't know what you want to be. I just checked the box going into college. I was in pre-dentistry. I thought, well, I don't want to work at night. I want to have a family. I want to work Monday through Thursday, 8 to 4, not work late hours, not be on call. I thought, well, dentistry sounded good. And I was really good at science and math. And I started shadowing a family friend. That's just about all I knew about dentistry before I went into dental school.
Okay, so our second question is, name something you love about dentistry and something you dislike about dentistry.
Something I love about dentistry is every person is a new puzzle that you have to create a custom treatment plan for, and you have to figure out what's best for that person, whether it's aesthetic, or with kids you have a lot of behavior challenges, so what's going to be the best for them. And then something I dislike about dentistry is having to worry about insurance and regulations and red tape and paperwork. If it was only like it was back in the day, didn't have to worry about anything else besides you and the patient, and you just sat down, you had no chart notes, you had no OSHA, HIPAA, all that stuff. And before the government got involved. That's the part I try to outsource as much as I can.
Okay, third question is, what's the number one thing you can do for good dental health?
I would say most people brush, so they probably need to hear more to floss every night. Number one, that and brush, and I don't even care if you use toothpaste or you just use water, but as long as you mechanically debride your teeth with bristles, getting the gums clean, getting the teeth clean, and flossing, that would be the number 1, 2, and 3 things you need to do.
So, do you brush before or after breakfast?
Well, I usually don't eat breakfast. Drink my coffee in the morning, and we'll usually fast in the morning. When I'm at home, like on the weekends, I'll brush after. So you want to clean your teeth of the food and of the carbohydrates and sugars after you eat, and then not before. It makes your food taste bad.
Would it be okay for someone to brush before and after? Does it matter?
I wouldn't brush before.
You wouldn't brush before?
There's really no point of brushing before. But it wouldn't really hurt.
Okay, Dr. Reynolds, how long have you been a dentist?
So I graduated University of Tennessee in Memphis in 2014.
Okay.
So I've been a dentist for 10 years. The first couple years after school are with probably the toughest, learning all the ins and outs and going pretty slow. I was always like really slow and steady, wins the race.
Yeah.
Really careful, and then now I feel like I can get my speed, make decisions quick, and know just a lot more, better foundation than I did back then.
Okay. When was the last time you cleaned someone's teeth?
With a toothbrush? Well, actually, last week I did pick up a Profi cup and polish some stain off a little boy's teeth in Eurydia's room.
Okay.
It had some staining, and I picked up a Profi cup with some pumice and polished it. I was showing her how the cup flares, so no matter how many years I've been in practice,
Yeah.
I'm still going back to the basics.
Keep it active.
Cleaning the teeth. But most of the time, I get somebody else to do it for me now.
Okay. What's your favorite procedure to do, and then what is your least favorite procedure?
Favorite that I like to see the end result on are the hardest. A lot of the times the things in life that are the most difficult and are the hardest to do, that take you the longest, and they're the things that are the most rewarding and fulfilling. So it'd be cosmetics, like your upper front 4 teeth.
Yeah.
And then being able to transform somebody's smile, that they come in and it takes hours and hours of work and meticulous polishing and just making sure every dimension and angle is perfect. But that's my favorite. Least favorite would be root canals. Would be my least favorite, like a
Least
molar.
favorite? Okay.
A molar in the back.
Yeah.
Because if you have big hands and you try to fit your hands all the way back on the very back tooth with a little file, and you're doing a root canal on a back tooth with somebody with a small mouth, it just doesn't work.
Lastly, do you have any advice for someone like me who's wanting to go into dental school or who has interest in a dental career?
Definitely focus on A's in school. So get all the prereqs, 4.0 GPA, they look at that really close,
Yeah.
and the DAT. So
Yeah.
a lot of schools, if you don't make the DAT, they won't even look at your application. Besides that, have your resume look good with volunteer experience. So Habitat
Yeah.
for Humanity, community kitchen, shadowing at dental offices, other medical offices, veterinary clinics, anywhere that you can volunteer through church is really important. They really want to see that you work hard and that you give back to your community. You know, they want to see that you can keep a schedule and that you can balance like the school load and your life kind of outside. So that'd be the study school, study for the DAT, and then volunteer would be my top three.
Okay. All right, Dr. Reynolds, thank you for your time and for doing this interview. And hopefully this community can also learn more about you and see how much that you do for us.
Well, thank you for interviewing me, and thank you for working here and investing your time here with me. You're my apprentice.
This is if
Like a
they
Jedi
accept
Master
me.
and an apprentice.
Okay. Yeah,
Together.
yeah.
Yeah.
Okay.
Or maybe like Sith Lord and
I don't know
No,
what
no.
you're talking about.
no, the evil Star
Oh,
Wars.
that's why.
Come on, Jedi.
Lord have mercy.
Like
You're gonna have that.
Okay,
We're here
okay.
with Dr. Reynolds.
I got too much chest hair showing up.
Okay. Okay, so could someone floss and then not brush? Like, is it actually that important, or?
Maybe if you got like a celery stick and scrub your tooth with a celery stick. Thank you for interviewing me and spending your time today. Terrible.